Today I'm going to share with you what you can do at home for L5-S1 disc pain. Hi, I'm Dr. Matt Bradbury, Family Corrective Chiropractor, and this is our office, One Life Family Chiropractic. If you're dealing with nagging low back pain in the back and in the buttocks, it shoots down the leg, in particular after you have been maybe sitting or bending over repeatedly, then you may have L5-S1 disc pain. I work with people every day who potentially have pain coming from the L5-S1 disc. So today I'm going to show you some things you can do to help yourself at home and some things you can do to help protect your spine and play more full out and live a higher quality of life so you can keep up with your kids, your grandkids, potentially that much better. So this is your spine, and it actually protects your nervous system, which is the delicate tissue on the inside, which you see here is yellow. And your brain has an extension called your spinal cord, which communicates with your muscles, organs, all the important things. And the messages start here and travel all the way down to here and all the way down to your toes, controlling your body. Now, the L5-S1 disc is actually right through here at the bottom. And oftentimes with repeated flexion or improper movement patterns, sometimes things may get wear and tear, and we may actually irritate the disc. We may press on the nerves. We may have some of that numbness, tingling going down the leg. We may have changes in motor control and changes just in terms of our quality of life and how we move. So there's some important things to watch out for. In particular, if you notice it aggravated more after sitting, then you potentially have an L5-S1 disc that's irritated. And I'm going to show you some things today that you can do. You want to avoid 3 things, and also some things that you can do for yourself to help build you up and be that much more resilient. So some things that you're going to want to be aware of, some things that you're going to want to start avoiding right now and changing the way you move. These are 3 things. Number 1 is deep forward bending. You know what I mean? When you're doing one of these, you're leaning over and you know you're doing it. You're slouching through here and you're reaching further than you should, and maybe it includes even a twist. That's a big no-no, and something that you want to avoid altogether. You want to avoid those huge flexion moments, that deep bend right through your lumbar spine. So have a look here. Let's do one of these, flexing you forward, which is pushing the pressure backwards, potentially irritating those nerves and that tissue in the back that's going to potentially cause and aggravate your problem even more. When you're sitting for long periods and potentially slouching, because this is your default, your muscles get fatigued and tired over time, especially on a soft couch. Guess what's happening? Your lumbar spine, you're starting to go into flexion. You're starting to tilt that pelvis posteriorly like this, which is not good. So first of all, with that one, you need to stand up. Or you need to even invest in a standing desk and make a point, if you're just standing up and still using that same desk, every 20 to 30 minutes, make sure you're standing up. Number 3 is that aggressive stretching of the hamstrings. This is something that may actually aggravate the tissues. If you constantly do that deep forward bending, you're back to bending and flexing that spine. And just do one of these. Really, you want to be in a better position when you're stretching your hamstrings. And I'm going to show you what that is. Ideally, how you want to stretch your hamstrings is keep your spine nice and tall and don't end up with that flexion in that lumbar spine. What I'm going to do is just focus on shifting my bum back and bending at my hip. And I'm going to do one of these just until I feel that tension. And what you can do is actually just lean forward lightly, hang out there, breathe, and you're going to hold this for 20 to 30 seconds, 2 to 3 times. And that's one way to avoid that aggressive stretching of your hamstrings, which may actually be aggravating the tissue. So just be extra aware of your low back and not flexing your lumbar spine. So keep that in mind. Now I'm going to share with you 3 ideas that you can do to help improve potentially your healing. 3 gentle movements, 3 things that you can do and be proactive about right now if you're suffering from L5-S1 disc pain. Number 1 is actually just start out by lying on your stomach like this, and I'll even start out lying on my elbows. And what you can do is just lie here, and you're actually doing the opposite of what may be aggravating the tissue. So I'm going to be here, and what can happen is you can progress this. So you can sit down if you watch your favorite sitcom at night or show for half an hour. You can lie on your stomach, so do the reverse of maybe what you've been doing all day. But number 2 is you can actually start to do one of these where I'll just walk up to my hands gently. And you may find a sense of relief when you get in this position. I'll come down just like this. I'll come up, I'll hold it for 10 to 20 seconds. And you can repeat that one 5 times. You could do the as a movement like the Cobra, or you can just do it as isometric and you just holding it here. If you want to take it one step further because you find maybe you're aggravated down one leg, is let's say it's the left leg, well then you may find if you shift your legs a little bit off to the left and lie like this with 10 to 15 degrees of leg shift, you may find it even easier. But you can experiment. You can shift off to the other side, see how you make out there. But really, it's going to be something that you can work with at home to help find positions of relief so you can get through your day that much easier. Now, number 2, when you're spending all this time sitting, what I want you to do, especially if you're at the desk for most of the day, is actually just spend some time doing what we were doing on your stomach, but doing what's called standing extensions. So what you're doing with standing extensions is literally just taking your hands like this and gently place them on your back, and you can just lean back like this. So give yourself a little bit of pressure on top of your hips and leaning back, and you may find that's just a position of relief that you need to find yourself in through multiple times of the day. You can even do one of these, put your arms over your head. If you have something where you can reach onto, I'll even do one of these. So I'll gently lean forward, bringing my spine into some extension, and I'll pause there 20, 30 seconds, and then relax. If you don't have something overhead, I mean, you can just use a door jamb, or if you go to the gym, you can use a bar across the top of the rig and just gently go into one of these positions. And from the side, it looks just like this. Just a little bit of extension and breathing. Really focus when you're doing this stuff, focus on breathing. Ideally longer out than in. So 4 seconds out, 2 seconds in, which is gonna help get you into a better state and help with potentially optimizing your healing. Number 3, in terms of simple things you can do to help optimize your healing, is just simply moving more, starting walking more. You'll notice I talk to many of my practice members in the office, and I share with them that, hey, you know, one of the simplest things you can do after you get checked and adjusted is just make a point of going for a walk. Now, this even includes at home. So if you're at home watching this, or you're on your lunch break or on a work break watching this, make a point of just going for a walk in terms of helping improve circulation, healing, and think about groceries into the tissue and garbage out, which simply by you moving more can really help with your overall healing response. And remember, movement is key for your health, optimizing where you're at, and helping to make sure you're as resilient as possible, and helping to improve your conditioning, get you moving and focused throughout the day. Now remember, these are some simple things that you can use throughout your day to help improve the healing process. Start doing them regularly, and like anything, you have to do them consistently to help set yourself up for success. If you do them here or there, they're much less likely to work for you. So consistently, all those simple things you can take daily action on in terms of 3 things to avoid right now, and of course 3 things that you can do to help improve your healing, to help get things going if you're suffering from potentially L5, S1 disc pain. Just keep those in mind. And of course, if you enjoyed this, I've shared it in the past that my mission is huge in terms of helping people understand their health more, and I simply cannot do it alone. So my only ask is that if you enjoyed this, yes, if you watched it all the way up until now and you got something out of it, please take a moment to share it and spread the message, because you never know who's going to get some benefit. Or if you're thinking of somebody who has potentially L5, S1 disc pain, grab the URL and send it off to them in the messenger or their email as well, so that they can get the benefit too. I greatly appreciate it in terms of helping people. We got a big mission that they need to be more functional for more health, and their spine and nervous system is vitally connected to their overall health as well. So thanks so much for your consideration. Thanks for tuning in. I'll talk to you soon. Bye for now.